how to practice medicine without being restricted with a physical location and have the flexibility to serve even more patients on your term. Now we can do that with telemedicine. Stay tuned as we learn how to create and run a successful tele-mental health practice. Private practice owners, are you ready to rewrite the rules for your practice so you can have more time off, a great team, and more income while delivering better patient care? Then you're in the right place. Welcome to The Provider's Edge TV. I'm your host, Sabrina Runbeck. I'm a provider, an international peak performance keynote speaker, and a best-selling author. My guests and I help providers like you to control your practice, control your life, and control your future. This is your defining moment to be a disruptor in healthcare. Welcome to another episode of The Provider's Edge. I'm your host, Sabrina Runbeck, and today we have Dr. Jay here. He is a physician associate and the owner and head clinician at Nevada Family Psychiatry in Las Vegas, Nevada. I actually have a bunch of meetings in there, so next time I'm in town, I'll definitely connect with you in person.
I would love to. Yeah, absolutely. That would be great.
Awesome. And he published in scientific journals and done international lectures on mental illnesses, professional fulfillment, and nutrition in mental health conditions since he graduated back in 1998. Thanks for being here.
Thank you so much, Sabrina. It is a true honor to be here and presenting.
I love that to feature healthcare professionals who go beyond what we do clinically, because we know at the end of the day, yes, we can create the impact on a day-to-day basis when patients come in to see us, but it's a lot more than that. Especially those like yourself have the bravery of running your own practice. There's a lot more hats that you're wearing, and then exciting to see that people are able to take on those roles and be a leader in the healthcare space and take care of their own community in a way that you know how to best support them. So I want to know, where did you come up with the passion, or what was the drive initially for you to step into healthcare and be MPA?
Yeah, that's interesting. I feel honored first to be here. I mean, the people that you've had on the Provider's Edge podcast have really been an inspiration to me as well. It's funny. I mean, my story is probably similar to a lot of theirs, which is that I kind of wanted a field in medicine that allowed me to kind of choose my own direction, allowed me to work lots of different shifts, allowed me to make a good living for myself and my family. And, I was in my early 20s, kind of out of college. My undergrad was in philosophy and performing arts. So not at all a science field. Believe me, if you went back to high school, I think you couldn't have convinced me that I ever would have gone into a science for my career. But I kind of found my own niche. I found out about the PA profession. I have several people who are nurses in my family. My mother is a PhD in nursing and retired about 10, 15 years ago, but, largely administrative work. But, they kind of told me about the PA profession that was kind of really growing in the 90s, especially. And so I ended up going into school in 96, and that was really new. I was in Illinois at the time. And it was, there were 3 PA schools there. So, it's amazing how much it's expanded in that time. But, I really love the idea of being able to move my career forward, be able to work in the health field. And I had no concept, really. I mean, it was funny, now these days, everybody has to rotate and spend time with a PA. The reality is there were only like 300 PAs in the state when I went to school. And there still aren't very many in Illinois, although it's gotten quite a bit bigger, but it's still one of the smaller states. But, I couldn't find a PA to save my life to try and find. So I ended up spending time with nurse practitioners and doctors. But, really, it's been everything that I could have imagined and more, and given me a great lifestyle and allowed me to do a lot for my community and for my family. So I feel truly blessed.
Yeah, I think that's the amazing part is we'll formulate where we need to be, and it's the right time, right place, and we take on that path and we own it. And I also had a bachelor in art in music, but my other half is on neuroscience. So I remember my senior year, I did my thesis on music therapy, just so I can combine the neuroscience side and then the music side. So it was fun. I think when we're in that younger state of figuring things out, and even even nowadays, there are medical school and PA school that they have combined shorter track programs. It definitely is changing how we see education altogether in the field. And as you're stepping into these roles, at what point did you feel like, hey, I really truly want to own the practice myself, and then it's the right time or right resources for you to pivot out?
Yeah, it's an interesting question. And, I've certainly talked to a lot of other PAs and nurse practitioners and other medical professionals about kind of when that time is right for that individual. PA ownership of businesses is still relatively small. Some of that is just that it's limited by state law and other issues, insurance reimbursement, and, how you can get credentialed and things like that. But, for me, I guess I've really had a strong sense of individuality. Probably comes, they always say that only children are, particularly kind of wanting to be self-sufficient. And that definitely, fit me to a T. I always wanted to be able to kind of do my own thing. And after several years in medicine, I realized that so much of what I wanted to do, was kind of dictated by the employer that I worked for, the hospital system, the physician that I worked for, especially as a new grad. And, I really wanted to be able to make those choices myself while still having the support that PAs can have through their supervising physician and their, collaborative environment that they find themselves in. Nobody works alone anymore. So being able to leverage that and the knowledge with other people and to know when I needed help, right? We don't need to be doing it all by ourselves. So through that time, I kind of started part-time doing my own work for a couple of days a week, and then gradually over, the next several years kind of did that starting full-time. So it's, I don't know that there's ever really a right answer, but for me, especially, I was in family practice when I started for about 3 or 4 years and then moved into psychiatry. Psychiatry is particularly beneficial and I think adaptive to business ownership for PAs and for that matter for NPs. It really lends itself to a good collaboration between lots of different health professionals and therapists and other groups, while at the same time making it, low barrier of entry. There's not a lot of equipment and other things that you can have. And it also just really met my needs as far as what I wanted to accomplish in medicine. Being that I had a philosophy degree to begin with, it's like, we always joke about the big questions, right? That's kind of what our life is in philosophy. But really, that's what we do in psychiatry too, right? We're talking about big issues, purposefulness and meaning and quality of life and why we're alive and what happiness is, right? And we're trying to figure that out in a collaborative relationship with our patients. And I love being able to do that and be able to direct that care and decide what that means for my patients, what kind of services I'm going to provide. And if I don't want to see a lot of people, then that's fine. I think my own mental health has always been a really, really important thing. And I have to, shout out to you. I mean, the Provider's Edge podcast has done such really great work with other people on professional fulfillment and burnout and stress and talking to people. I mean, we are in an environment where, especially the past 10 years, we've really begun to recognize the impact that has, right? And so, that has been really important for me too. To say, I don't need to make a lot of money right now. It's more important for me to have a good quality of life, to be able to be there for my family. I can go to my son's dance things. I can go spend time and take vacations and not feel guilty. And I think that's what we all want, right? I mean, that's kind of why we, especially with PAs and NPs, they wanted to be able to have that balance. And that's just so important.
I think that's a great point also bring up, not even just in the current era, that's also a generational movement into especially the younger generation. We see it as, perhaps they're not wanting to work as much, but that's not it. It's that we start seeing different value in what life means to us. And career is just one of those 10 pillars. So it's about finding out what are the ways that are sustainable for us. So for you, are you in still, do you have a clinic? Do you have virtual? How does that work for you right now?
Sure. I've had a clinic for a long time, 15, 16 years. The pandemic clearly has changed a lot of that. I still have a clinic and I still see people about 2 days a week there, but I do a lot of virtual visits now. And I also contract out services. My company contracts out to other private practices, to therapy groups that have people that they want want to see for psychiatry. So I'll work with them as well. Some of them on a weekly basis, some, every other week or once a month or something like that to see their patients, depending on how many patients they have. But yeah, I am still kind of doing it. So it's still a lot of hybrid that's working right now. I mean, one of the advantages of psychiatry, although I know it's happening in lots of other fields, but psychiatry is particularly adept to video times, right? I mean, it's good to get a blood pressure and a weight on clients, and I do that a lot, but we don't need to listen to their heart and their lungs. We're not doing an elaborate physical exam. So much of it is just really connection between people and making sure that we're listening to issues that are important to them and then working on those, right? And so that's been really good.
Yeah, I was just at a primary care consortium in the state of Texas. Something that we talked about is that connection of bridging the mental health side into the primary care and then closing that loop altogether. And we have been seeing is various different digital health solutions. So whether you're using remote biometric monitoring, which is now the same as your chronic disease, versus your telemedicine, where you can be hopping on as a mental health visit versus like medical consultation, right? And then that can be an interface. Right. Are you also doing some of that with remote monitoring, disease management type of work as well?
I'm not doing it yet. As far as I know, I mean, there's some kind of preliminary research coming out on looking at, how people move and things like that, especially with movement disorders, Parkinson's and things like that, Alzheimer's, dementia. I haven't heard a lot of great research on depression and anxiety as far as remote monitoring. So, a lot of chronic diseases, and I end up doing, because of my family practice background, I don't manage those chronic diseases, but I do end up screening for them and talking to people a lot about that. One of my other passions besides kind of healthcare professional burnout and professional fulfillment is also talking about diet and the role in mental health, but also in physical health, right? I mean, it's all the same. I think that one of the biggest things that's happened in the past 24 years since I graduated, but it was kind of ongoing starting in the 90s and 80s, is, the brain and the body are connected, right? We say that pretty obviously now, but it was really the paradigm that, well, you had a physical problem or you had a mental problem, right? But those things aren't separated, right? The brain is communicating constantly with the body and vice versa, right? Through, hormones and inflammatory cytokines and all these neurochemicals, right? So we need to understand that everything that we do affects every system in our body. And if you have an out of control blood pressure or diabetes, or you have cancer, or you have chronic pain, of course, that's going to affect your mental health. It's going to affect your sleeping. It's going to affect your hormones, right? So being able to pay attention to that, screen for that, talk to people about the role of diet, talk to people about what that means. I mean, everybody's concerned about losing weight. Of course, we use that as the kind of paradigm in America, right? Oh, yeah, you're losing weight. But that doesn't particularly matter. I know that's sacrilegious to say. But, in the end, we need to live better, right? I always tell people it doesn't matter if you live to 150 if the last 100 of them are miserable, right? I mean, it's like, why are we trying to do all these things with quantity of life when the whole point is we want to live better, right? It would be nice if we didn't die at 52, but we want to live better for longer. We want to be able to spend time with our kids and grandkids. We want to be able to enjoy retirement. We want to feel good and not be in pain and not have Alzheimer's and not have Parkinson's and not have diabetes or can't climb up the stairs, right? So those things all impact psychiatry and mental health. And that's really what I'm really passionate about.
Right. There's a lot of interfaces between our diet, our physical activity, because we know, yes, there's a lot of neurological issues that cause us to be less fit. Yes, we can always say, oh, we have to have this XYZ plan, but we adapt into what we can do. Same thing with our diet. There, even from a functional medicine standpoint, people even talk about your blood type into your digestion, running full panels that we typically don't do a lot in the traditional primary care sense. So there are multiple different components on our gut health that has, we know serotonin in there has a lot more, right, than in our brain. So for back in school days, right, or any stressful moment, I know all of us have that gut feeling, the crunch. Well, like that's the same thing as how our patients, especially when they are having more of a mental fitness concern, to be able to address how we eat really affecting everything in our life, not just the obesity pandemic that we're facing or the coronary artery disease that they really should be addressing, but so many more things. And I love that you're adding different components of wellness and holistic care into mental health as well. So just wondering, how many patients are you seeing on a daily basis now?
I would say I typically see about 15, maybe something like that. It depends, depending on, how much I'm working that day, but I would say somewhere between 12 and 15 is about average. So yeah, and it's kind of a combination. Obviously, all my patients are mental health focused, but a lot of times we'll focus more on diet and other things like that. I mean, I don't think those things are independent. I mean, the thing about a healthier diet is, we don't just live longer, but we die less painfully too, right? I mean, the point is we're not trying to live forever. What we're trying to do is to address issues of quality of life. Everybody wants those things, right? I mean, a long, long time ago, we recognized the impact that tobacco had on our health, right? But 50, 60 years ago, that wasn't the case, right? I mean, that tobacco was outed as the killer that it was a long time ago. But somehow we're still serving bacon at medical conferences, right? Because nobody thinks that that's healthy for us, right? And yet we're still kind of saying, oh, well, yeah, but every once in a while, right? But we don't think that about cigarettes anymore. We don't think like 1 or 2 cigarettes a day is okay, right? So, we constantly have to be addressing these things and realizing that there's a real biological drive for these things, right? There's a real component of that our body has been working on for tens of thousands of years, hundreds of thousands of years. If you came across a donut 10,000 years ago, you better eat it, right? I mean, because you weren't going to come across that again. And you were walking 20 or 30 miles a day, right? So trying to understand how our bodies and our lives and the demands on us have changed, really, especially over the past 100 years, but especially over the past couple thousand years, right? And yet our brain hasn't changed very much at all, right? As far as how it works, how it's wired, how we respond to stress and danger and anxiety, all those things are wired in there. And unlike cigarettes, which we can completely stop and never need again, everybody has to eat, right? We all have to have that drive. And so then the question is, what do we eat, right? I mean, the CDC says that 1/3 of all deaths in the United States are due to diet-related conditions. 1/3, right? I mean, those are hundreds of millions of people, certainly worldwide, that are dying every day from heart disease and diabetes and, obesity-related things, right? All these things, not to mention all the cancers that are diet-related. So if we can talk to people about these things, a lot of times I'll talk to people and they say, well, I thought you were in psychiatry, but to me, thinking that psychiatry is just about people who are depressed or anxious or schizophrenia or having bipolar disorder is missing the point, right? Psychiatry, just like family practice, just like every other field of medicine, is about addressing our patients' needs, right? It's about quality of life. What do people care about, right? Identifying that, addressing that, moving those people forward on their journey, that is the point, right? And it's great to be, less anxious or less depressed. But if we end up dying at 65 of a heart attack or stroke, I don't know that I've done anybody any favors, right? Not to mention that you suffer before that. So, really addressing that. And we're starting to understand so much about that now. You mentioned gut bacteria, but, that's just part of it, right? I mean, inflammatory cytokines, how we're metabolizing certain medicines, right? The genetics and the epigenetics associated with, our environment and our food and stress level and sleep level, right? All these things play a huge, huge impact. So I talk to people a lot about that, and I think it's really, really important. I mean, I think we're missing part of that in medicine. We're kind of staying in our own little lane, but I don't know what our lane is, right? I mean, we're in healthcare, right? And that's what we're supposed to be addressing.
Right. It's about integration. At the end of the day, we can even apply those to our own life. Are we living for what purpose, and what's that big mission that we're going after? And yes, nowadays we talk about biohacking even. Now, some of those activities, treatments, whatnot are for people cash paid. So that means people can actually need to be able to afford that. So are we doing that as providers for ourselves? Recommending for our patient, but what about all the underserved, underinsured, then they can't even get basic care because they keep running to the ER just for that one thing. And perhaps they did see you in a clinic, but they can be lost in follow-up for the past 3 years. You have no idea what's happening with them, or you have no staff to be able to reach out to them to close that loop. So I know thinking about quality of life for us is very important to be able to sustain the practice so we can provide the care and serve our community. So we don't do that alone, and I'm sure you don't either. So Jake, how many people are on your team nowadays, just to keep workflow wise?
Yeah, I have a really small team. I typically work with 2 other people, and they're both staff members. They're not clinicians. I have intentionally kind of kept it really small. Another one of the components, I realized that a lot of the people you work with are growing big teams and doing lots of things. And I know that's part of the focus that you provide with business counseling and obviously the work that you've done with expanding, the outreach that you've done has been incredible. I've kind of decided that I'm really happy in my little corner of the world. I would love to be able to expand this to other people, obviously, and part of that is leverage. But I've always had to kind of balance out my own mental health and my own time needs with, what I have available to me. And so, I think that there are amazing people doing some great work on nutrition and mental health. There's some interesting work being done on burnout. I just completed a doctorate in health science, and part of my work was on burnout. And I'd love to be able to do more research. I'm trying to publish my kind of dissertation work at this point on professional fulfillment in PAs and how that affects stress and anxiety and depression. I think that is a field that really needs to be kind of pushed. But I've also wanted to do a lot of things. I guess I would say that I'm one of those people that kind of gets bored easily. And so I've always wanted to do lots of different things. I like to have my hands in a lot of different pies. And while at the same time realizing that I have to have the balance of being able to spend time with my family and be able to read and be able to get good sleep and, all those other things. And I think that's a tricky proposition for a lot of people to do because we, like you said, it's work and career is only one of the 10 pillars. Right. So it's like we need to make sure that we're taking care of ourselves while we address the fact that work is really important. Right. I mean, that's a really important part of our life, but it's not everything. Right. And it's certainly not 50%. Right. And I think that that's hard. So I've kept that really minimal. I think that we'll see what the next several years brings with that. I think that leveraging the passion that I have for the interest that I have is really important, but I want to make sure to do that in a way that actually allows me to maintain control over the quality of that, while at the same time making sure that I'm doing okay myself. And I think we, a lot of times we lose track of that when we move too fast. So I've always been on a more of a slow and steady wins the race kind of thing.
Yeah, at the end of the day, we have to find out what works best for us. It can be just that small team because it's core, you already have synergy, you don't need an extra. And then we just have to contract out perhaps for the marketing side, for the billing side, for the additional ancillary back admin side, but we don't have to be so involved with everything to think about growth and scaling. And of course, we all are in a place like yourself. Healthcare leaders are so good at getting things done and so good about coming up with ideas and wanting to be in a lot of different places. And so which area do you feel like that you are focusing on to up level right now?
Right now, I'm really focusing on the research component of burnout, probably because I literally just graduated in May. So the past 4 months or so have really been about trying to, update the research, make sure that I'm looking at the various components. We're looking at the difference between professional fulfillment, burnout, depression, anxiety, stress, certainly COVID and how that's changed a huge amount of things. And I already know that it's increased, mental health and substance abuse, just amazing amounts. And there's really interesting data coming out of the CDC and the World Health Organization on all of those things. But, trying to focus on that is really important. But I also realize that I want to leverage that with nutrition, with mental health. It's a kind of a different thing. So I'm kind of trying to do it all, I guess, is what it is. So we'll see what happens over the next, 6 months or a year. I'm not a faculty member, so I don't have a connection with a university right now, but I think probably teaching will become more part of my life over the next, 5 years or so. I don't think I'll ever become full-time in that area because I love what I do on the clinical side. I love being able to see patients and be able to talk with them and do that. So I would hate to lose that, but I realize that, as I look at, the next 10 to 20 years until I retire, I want to be able to leverage some of the skills and the things that I've learned through my doctorate.
Yeah, definitely a lot of research out there, but now many just specific focus on the PAs and NPs. Those are advanced practitioners, and most of them are just the nursing or just the physician side. So looking into what you have researched, that's so important. I know we can talk about for hours and interesting topic, and I know people would want to hear more from you. So how can they connect with you or check your website? What's the best way?
Sure. Probably through my website. I can also give you my email as well. The website is just psychiatry.vegas. So you can put in www.psychiatry.vegas and that goes up and there's a connection right through there. But you can also reach out to me directly. My direct email is jsomers@psychiatry.vegas. So just my last name, SOMERS with a J in front of it. And yeah, that's the easiest way. And I check that all the time and, connect with a lot of people throughout the country, really trying to work with nurse practitioners and PAs on this burnout issue, because clearly it's affecting everybody. There's some great work done and the nurses have done so much of a better job, I think, unfortunately, than PAs. I mean, there are a lot more of them, but, really worked out into the burnout and looking at the impact of that. But I think we really need to work as advanced practice providers on addressing this issue because it's not getting better, right? And I think a lot of it is just, again, focusing on our quality of life. It's so hard when so many people need us, right? I mean, the need is so great. We have such a deficiency of all healthcare providers, but especially mental health providers in this country in so many areas that we need to be able to reach out and expand that so we really address those things. But I think it's also about realizing that, every provider, and this sounds trite, every provider is a mental health provider, right? I mean, everything that you do in healthcare has in some way to do with mental health, right? You may think that if you're in orthopedics or dermatology or OBGYN or family, that isn't the case. But even in surgery, right? I mean, people are scared, people are in pain, people have inflammation. That affects mental health. It affects sleeping, it affects gut bacteria, it affects neurochemical production, right? And it affects our quality of life. So, just because we don't have another medicine to give people doesn't mean we can't address their needs. So making sure that we're doing that. And I would love to be able to leverage, other people and their work and the research they're doing and just interest in a community, because I think that's how we're going to succeed, right? That's how we're going to refocus and rebuild healthcare from the system we have now into something that's going to get us to the next generation and really address providers' needs, make sure we're not burning out, and patient needs to make sure we're leveraging all the skills and talents that we have to help them.
Yeah, exactly. So correct. We know at the end of the day, there's a lot of things we want to do, a lot of things other people expect us to do, plus what we wanted to pour out. So it can be a lot of decision fatigue. And then I'll come back on how you make that decision. How do you perceive the problem? And I love for you guys to stay in touch. And we thank you for being here with us. And until next time.
Thanks a lot, Sabrina.
Are you an established owner or executive who has a thriving and successful healthcare practice? We want to hear your story live on the show. Become one of our guest speakers so you can inspire other practitioners like us, arrive as an authority in your field, and connect with thousands of like-minded healthcare leaders who need to hear what you have to say. Apply to be a featured guest speaker on an episode on The Provider's Edge by visiting sabrinarunbeck.com/interviews.